Hello there. Thank you once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We are continuing our discussion around the COVID-19 pandemic because it's a real issue and it continues to haunt us every day. It affects our daily activities in ways that we could not have imagined a couple years ago. Remember, if you have any questions or comments, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. I'm wearing my mask the correct way to cover both my nose and mouth. I will now take it off to continue this conversation with you. In recent times, if you've been watching television or you've been following the news at all, you must have encountered something called the Delta variant. Now, the COVID-19 virus started out in China and it has progressed to different countries, many countries around the world. In fact, almost every single country around the world has been touched one way or the other by COVID-19. As all viruses do to survive, the COVID-19 virus has also followed the same pattern of previous viruses by mutating or creating variant strains. It changes up its own genetic formations in order to become more potent, more deadly, and to survive in humans. So the first strain that was identified in China was labeled Alpha. We had Beta from the UK. We now have Delta which came out of India. We had Gamma, which came out of Brazil, I believe. And there's some other strains in South America, Lambda, etc., that have been gaining attention. But none more deadly, more contagious than the Delta variant so far. And this is what we first recognized coming out of India. So you've asked some questions about the Delta variant, and today we'll spend the next couple of minutes trying to answer those questions related to the Delta variant. So what is the COVID-19 Delta variant? The Delta variant is a mutation of the virus that causes COVID-19. Mutation simply means it changes form from one to the other. This variant, the Delta variant, spreads more easily and more quickly than the others. The original Alpha variant or the Alpha type of the COVID-19 virus was thought of in the following way, that one positive person could infect two others around him. So one positive can infect two persons. That's in the original Alpha variant. The Delta variant is much more contagious. One positive person can infect 6 persons around them. That's a 6-person risk for every one person who is positive in a group. The COVID-19 vaccines that we have currently in use thankfully offer good protection against the Delta variant. So even though this virus has changed and mutated into this new, more contagious variant, the vaccines that we currently have available, they are still effective against it from causing severe disease. COVID-19 vaccines have shown excellent effectiveness in preventing hospitalization and death. So you get hospitalized when you're moderate to severe, and of course death is the ultimate bad outcome. And these vaccines have the same effect against the Delta variant as they do the Alpha, the Beta, as well as the Gamma. The Delta variant most severely impacts those people who are not vaccinated against COVID-19. This includes people who only received the first dose of any of the 2-dose vaccines. Important facts to note that the variant known as the Delta variant is much more contagious, so it spreads easily from one person to the other. But thankfully, the vaccines that we have available for use are still effective against this Delta variant, causing severe COVID in persons who become infected. Continuing our discussion on the Delta variant, you can best protect yourself against Delta variant by becoming fully vaccinated against COVID-19. Experts at the CDC, which is the Center for Disease Control and Prevention, are continuing to study the Delta variant. Not just the CDC, but all other health organizations concerned with infectious diseases across the world have been continuing to study this much more virulent and infectious mutated strain. They have concluded that COVID-19 vaccines offer good protection against the COVID-19 variants. Those who have received 2-dose vaccines will be fully vaccinated 2 weeks after they have received their second dose of the 2-dose vaccines. Remember, we had spoken about this on an earlier episode. Once you get your second dose of the vaccine, you're not immediately considered to be fully vaccinated. You have to wait about 2 weeks after, where your immune system starts to really ramp up production of its defense mechanisms or antibodies. And after that 2-week period, that's when you're considered to be fully vaccinated. According to the WHO, the Delta variant, which was first recognized in India, has spread to a number of countries across the globe. At last count in June, it had touched on more than 80 countries around the world. These include large populated countries and continents like the US, the UK, China, the entire African continent, Scandinavia, and the Pacific Rim countries. In the US, it made up about 10% of all infections that were seen in June, and now that we're in August, it's closer to 50% of all new COVID-19 infections. So it is quite rampant in the US. And this represents a dramatic change in the number of persons who are infected. In the UK, as of June this year, it made up about 60% of all new cases of COVID-19 infection. It is believed to be the driver of the second COVID wave that was seen in India, that was so deadly that hundreds of thousands of people were recorded as being positive daily and thousands were dying per day. It is indeed a notorious variant. In April of 2021, the WHO designated Delta as a variant of interest. And in May, the WHO had labeled 3 variants of concern: the Gamma from Brazil, the Beta from South Africa, and the Delta, which emerged from India. The Delta has fast become the most worrisome of all of these variants that have been identified, because it is more transmissible than other variants. Means you can spread it from one person to the other much more quickly and effectively than the other variants. It is suspected that this variant can cause more severe symptoms, and therefore it can cause worse outcomes. And it has indeed been reported to cause breakthrough cases, What are breakthrough cases? Indeed, persons who are fully vaccinated can become infected. They can contract COVID-19. But the good news about the fully vaccinated persons are that even if they do get COVID-19 infection and become positive, they do not, as a rule, become severely ill, and they're not admitted to the ICU, and they don't die. 99.999% of all deaths seen in the US for the last couple of months were in persons who were not vaccinated. Not vaccinated. So, is the variant, the Delta variant, more transmissible? Well, you can know the answer from that from all that I had said before. Many studies have shown that the Delta variant may be more transmissible than many other variants of the virus. A study commissioned by the UK government found that infections increased by 50% between the 3rd of May and the 7th of June, coinciding with the rise of the Delta variant in the UK. Remember, we don't check for specific variants in every case that is tested because it costs a lot more to check for variants, and it's purely of academic and epidemiologic interest. The Delta, or data from nearly 110,000 swab tests carried out across England, suggests that COVID cases are doubling every 14 days, and this was in June 2021. Experts from the Imperial College London said that the Delta now accounted for up to 90% of all coronavirus cases. So indeed, in the UK and the rest of Europe, most likely, the Delta variant has been wreaking havoc by being the dominant force in the number of positive cases and the dominant force in creating much more severe illness. Can the Delta evade the vaccine? That's a very important question, and it is important to know that the answer is yes, that even if you are vaccinated, you can become infected with the Delta variant. And in one study in the UK, of all of the thousands of new cases, they found 63 cases of people who got breakthrough infections. Of those 63 cases, 36 were seen in patients who had received 2 doses of the vaccine, and 27 were seen in persons who had received a single dose only of the vaccine. So that's 63 persons out of several thousands that were tested positive. So even if you were to get COVID with the vaccine, it is extremely rare. The majority of persons who are testing positive for COVID-19 are not persons who are fully vaccinated. The vaccine effectiveness against the Delta has come under increasing interest of study, and experts believe that the 2 key mutations in Delta could help the virus evade some antibodies that are produced from vaccination. According to Public Health England, the vaccine effectiveness against symptomatic disease with the Delta variant was seen to be 88% in those who received 2 doses of Pfizer and 67% in those who received 2 doses of AstraZeneca. That is for symptomatic disease. For hospitalization with the Delta variant, we have seen a 96% protection with Pfizer and the Pfizer vaccine, and a 92% protection with the AstraZeneca vaccine. That is against hospitalization, even if you become infected after getting fully vaccinated. So I hope this would have helped us to understand a little bit more about the facts surrounding the Delta variant of the COVID-19 virus. Remember, if you have any questions or comments, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me, and I'll see you next time.